Well, good morning, good afternoon, good evening, depending on your time zone. And welcome to our webinar today, where we're going to be discussing the health implications of loss and damage. Long title, we're looking at impacts, responses, and the role of the UNFCCC mechanisms. I think if you've been at all around the climate agenda in the last few years, then loss and damage is moving further and further up the agenda. But I think many of us feel that there's two sides of this. There's many of us feel that the loss and damage is something we should know a lot more about. We should understand, we should be more engaged with, but it's seen as quite a technical issue and for those in the know and those who are following it. So I'm hoping by the end of the webinar today that some of you who are coming at loss and damage you'll understand, quite fresh, you'll understand it better and feel more confident in that space. On the other side, we know that loss and damage has health implications, but it's seen more as a financial mechanism, and loss and health, as you'll hear, is a non-economic loss and damage. It's considered, although it has many financial implications. So I think that hopefully by the end of it, we'll also understand that the critical role of health action within the loss and damage, and maybe have a start to think about how the two topics of health and disasters and health and in that loss and damage context can play into the UNFCCC and international discussions in this place. So to do that, it's really an exploration today, and as I say, I hope we all come out a bit more enlightened. I think this week, what really struck me about linking climate and loss and damage and health was the announcement of the UN Secretary General requesting more money for the devastating floods in Pakistan. And the focus of that was on health, was particularly waterborne diseases and fresh water. So health was put at the centre of that. Even though it looks like a climate and an environmental issue and an infrastructure issue, health is at the centre. So I think we'll hear more about that today as well. We've got an amazing panel, and just a little bit of background to the Health and Climate Network. We're hosting this alongside E3G, the climate think tank. I'm sure many of you have come across if you work in the climate sphere. But the Health and Climate Network, I'm the director. We've been around about a year and a half, and our main objective is to get health people talking and actively working with climate people, energy people, people that that are not usually the people that they're talking to directly, and vice versa, getting people working in energy disasters, loss and damage, climate agendas much more confident talking about the health aspects and where health fits into it. So this webinar today fits very soundly in that space. So our panel today, let's move on to that, which is what you've come to hear. We've got Maria Guevara from Médecins Sans Frontières. She's our international medical secretary. She has many years working in humanitarian sector in many parts of the world, and will present today some of the real life experiences, really that loss and damage in your face, that are, just as the experiences there and responses to that. We also have Taylor Dimsdale. Taylor is the director for E3G of Risk and Resilience Programme. He works with governments and public institutions and the private sector to ensure that their decision making is informed by better understanding of climate risk. So putting climate risk at the heart of the loss and damage discussion, and where again health fits into that. We have Colin McQuiston. He's head of climate and resilience for Practical Action. He works globally and at a country level, so actually in the field, exploring the critical advocacy and knowledge generation needs that will lead to the changes necessary to reduce the risk for poor and vulnerable communities. Colin's got he's been a long time observer of the Warsaw International Mechanism and the various UNFCCC loss and damage mechanisms, and is really at the heart of the debate at the COPs. And last and definitely not least is Elizabeth Willits. She's a consultant with the World Health Organization Climate and Health team. Liz's focus is on that nexus between environment and health. She's a primary care clinician and has 14 years as a policy on policy and analysis, attending and tracking the UN international negotiations. So that real bridge between the health and those international negotiations. Fantastic panel today. I'm really looking forward to your presentations. So I'll hand over first to Maria, please, if you can give us we'll give the 4 presentations, And then we'll have time for questions and answers. So put your questions in the Q&A box, put them at any time, and we'll come back to them after all 4 presentations. Maria.
Thank you. Good day and good afternoon to all. I'm going to try to share my screen, and hopefully it is working. Can you see this?
Yes.
Perfect. Thank you. So yes, thank you for the warm welcome, Alison, and for the invitation to join in on this discussion of what probably surely should have already been on the climate change negotiation agenda from day 0. So the health and vulnerability implications of climate change and the resultant loss and damages impact. Actually, there's much to say and do about this topic. And seeing as I'm amongst some experts in the political debate, my focus here is actually to contribute to how this narrative on loss and damage translates in the field and what human-induced climate change looks like on the ground from a medical humanitarian actors perspective, namely Médecins Sans Frontières, Doctors Without Borders. So first, though, before, I wanted to remind what we're talking about and also remind myself as we discuss this in MSF, is what is loss and damage, and assuming general consensus, hoping that Taylor will shed more light on this and correct me as needed, is that there is actually no official definition of loss and damage, and that it's, you know, in the previous studies that I've looked into, the Development Asia, which is the Asia Development Bank's knowledge collaboration platform, in their publication 2017, basically when they were comparing the definitions from the UNFCCC in 2012 from the other organizations like UN and World Bank, there is actually differences in the way they interpret that. And a more recent publication by the Chatham House confirms that there is actually no internationally agreed upon definition. But the working one is that the loss and damage normally refers to the destructive impact of climate change. It cannot be avoided either by mitigation or adaptation. So the point here being that climate change is already having negative impacts on the ecosystems, infrastructures, people's health, livelihoods around the world. For MSF, it simply means emergency. So what I wanted to do is words, I can speak on words, but I think pictures is worth 1,000 words, as they say on the adage. And so what I wanted to do was take you through a few images. And this one, as already mentioned by Alison, is the one that we've heard in the most recent month, which is the Pakistani floods. And actually on August 31st, the Pakistani government called a state of emergency after the floods deluged through the country, coming in quite fast and furious. And we've seen all the media coverage and images. It's flashed across all media platforms. And we know from that September data that Pakistan has already suffered about $10 billion with 33 million people affected. And the UN UN Secretary General has called it an unprecedented event of extreme proportions, calling it a monsoon on steroids, and repeatedly warns us of the impending dangers of climate change to the future of humanity. For MSF, we immediately responded because we have been in country for decades, in fact. And we were already in Sindh, Balochistan, and Khyber Pakhtunkhwa. And we also ran assessments in the Punjab province. So we were running consultations through mobile clinics, medical tents, trying to get shelter for those who were dispersed and left in camps. We also those who have fled and hard to reach because of the flood waters. What we're seeing is a lot of skin diseases, diarrhea, malaria, eye infections, much more, problems with water and sanitation and food insecurity. To date, actually, we've done already 10,000 consultations. We've distributed non-food items, and we've provided clean water through water tanks and filtration. The thing is, maybe it's better for me to show you a video where we actually recorded our staff and what they've seen. And let me just play that. Tell me a minute. So go back about 12 years before. A lot have been comparing this floods to the one in 2010. We also responded at that time, and it cost an estimated 1,700 deaths of 20 million people. Essentially, we were doing similar work, but according to climate scientists, they're actually quite different. So that means that in 2010 disaster, while it may have been triggered by heavy rainfall, it was mainly because of riverine floods. The deluge this time of this year's floods was 4 times the long-term average actually of heavy rainfall that's hit the region. And the problem is then it was compounded by the riverine floods. The only thing is the 2010 was actually a single concentrated event in July of that year. Well, this one was ongoing. And the problem also is that in Sindh and Balochistan, infrastructures to deal with the heavy rains were not in place. So essentially what we're seeing is that the warming of oceans in the atmosphere simply actually means that there's just more moisture in the air, and hence when it rains, it pours. Also here for MSF, we've been in Pakistan for decades, at least since 1986, because we've been there trying to support on the country having faced or being faced with conflict, with natural disasters, poor healthcare access. Today, we actually have nearly 2,000 staff, both international and national. Majority of those, about 1,700 being national staff, try to answer to the needs. Mainly to highlight that here, the needs, they're already bereft of all the resources they need to bounce back from one disaster to the next. Let me move on to another region, which is in the Lake Chad region. And here's an image of the Lake Chad that's by the UN Environment Program. And it is a picture from the 1970s, I think, to 2007. But basically what it's highlighting is that the Lake Chad has shrunk 90% over the last 60 years. And it went from about 26,000 square kilometers in the 1960s to about 1,500 square kilometers today. And that has an actual ripple effect across the region, including contributing to the conflict. So all this is actually compounding the need with the challenges of the ever-changing climate systems. The temperatures are rising, and the impacts on actually food sustainability or access, including water access, and then of course the community fighting with, and then being exposed to terrorist groups. So essentially the normal coping mechanisms are fading away, and the locals are increasingly unable to sustain their lives in place. And where MSF has been is actually in all those countries surrounding the Lake Chad region. In Niger, we've been there since 1985. For those who know us, we started from Nigeria as an organization in 1971, but we have been continuously there since 1996. We've been in Cameroon since 1984 and in Chad since, since the 1980s as well. But I wanted to focus on Chad, so I will just move on forward to that. And basically, recently we published this piece where we quoted one of the mothers who had come in to bring their child for severe malnutrition. And basically, it's the quote of, if the rain abandons us again, we don't know what we will do. The issue in Chad is that the malnutrition crisis used to be a recurrent kind of seasonal issue, but now it's not just a hunger gap, it is a continuous crisis. And MSF in 2021 launched a malnutrition or ATFC, acute malnutrition program in the Chad's Hajer Lamis province. In fact, we've been in Chad since 1981, providing all kinds of care from those who are affected from conflict, but also with the repeated epidemics and nutrition crisis. I was in Chad in August of last year. I went there to create a surge team for the emergency response at that time, just before this malnutrition program was opened. I was there to try to launch a measles vaccination campaign to prevent a measles outbreak that was threatening to come actually in the south-southwest south-southeast of the region. Unfortunately, in just the less than 3 weeks I was there, we had an increase in refugees coming into Central African Republic. We had new Cameroonian refugees coming across the border just south of N'Djamena, the capital, because of tribal fighting, where you had those who were fishermen and trying to dig really deep because there is no more water to fish, and then the pastoralist herd would fall in, and that created a tribal fight and burning of villages that caused the fleeing. So just saying that here there is no lack of emergencies and it's a compounding. But what we are trying to innovate, so when we did open up these projects for malnutrition, we started to co-design the programs with the community for the sustainability aspects in the sense of continuation, but also because of empowering of the community. We know that in any emergencies, the first responders are always the community. They know best what they need, and it's important now that we actually work with them as partners. So just a bit of reminder of this year's, or in this past year's year, the Intergovernmental Panel of Climate Change released their 6th assessment report, and there is no question that there is an unequivocal link to health for the climate crisis. Whether that's on the physical and mental health worldwide, the extreme heat events that we see everywhere, the food-borne and waterborne diseases, food insecurity and malnutrition, vector-borne diseases, zoonosis, NCDs or cardiovascular respiratory diseases, and as we've just heard, the increasing severity of extreme weather events. It's also more noted now that there is definitely a contribution or driving or exponential contribution of climate change and environmental degradation to violent conflict and displacement of populations. But also, the IPCC 6 report also said that this is a humanitarian concern. And that's stated in this phrase that vulnerability to climate change differs substantially among and within regions, driven by patterns of socioeconomic development and sustainability, and you can read the rest. But this is patterns of inequity, such as colonialism and governance. For MSF, that vulnerability of climate hotspots is in fact the humanitarian hotspots where we work, and these matches on the red spots. But unfortunately, these hotspots are also blind spots for the rest of the world. And this is where we are even more concerned. So what are we doing in MSF? Some of us are framing this within the planetary health framing, which actually centralizes humans as the responsible, but also possibly the solution and that we are interdependent within our ecosystem, and we have to be responsible in managing that. So it's a three-pillared approach of operational adaptation with a real focus on anticipation, like the meteorological anticipation, climate adaptation. Now we're linking to epidemiological data, which with the malaria anticipation program that we've just launched in South Sudan, for example. We've also been working on mitigating our footprint with the first do no harm principle, and of course, adding our voice as climate witness. And including to that is actually a participation in the narrative that's going out there, adding our experience from the field and the different Lancet Countdown briefs, working on this year's now. We are also going to engage at the COP more and more. And last year was the first time we were official observers. And we will continue to do that this year, where we will bring the health and humanitarian and link it to the humanitarian crisis. And here also we've committed with others on the humanitarian front to decarbonize and work on our footprint to help safeguard the most vulnerable. I guess just to finish and to reiterate the call for this is that, to quote our current president, Dr. Christos Christou, human health will be increasingly damaged by the negative consequences of the climate emergency. Failing to act now would mean breaking our medical and ethical obligations towards patients and communities. As the health and humanitarian community, we have a responsibility to address this. Thank you.
Wow, thank you, Maria. That quite dramatic impacts, which are very much here and now and happening right now. They're not in the future. And I think also the contrast of the different examples, the very dramatic incidents like in Pakistan, and that slow onset that you have in the Chad basin, that and actually linking conflict to that resource conflict that's come from climate conflict. It's such a complex issue, and there's many manifestations of the climate-induced impacts and health outcomes. So I think that's been really interesting. We'll move on swiftly to Taylor, who's going to put this into the context of climate risk.
Sure, thanks very much, Alison, and thanks for organizing this event. I think it's a really important and timely conversation, so it's a pleasure to be with everyone today. I'll just pull up my slides, which hopefully everyone can see. So I think Maria has given us a really kind of excellent overview of some of the links between climate impacts and health, and some really powerful examples, I think, of what that means in terms of, concretely on the ground. I'm gonna take a bit of a step back and try to provide sort of an overview of loss and damage as an issue, both as it's understood, in the context of the climate negotiations, but also more broadly. Some of this will pick up on some of the points that Maria raised. So I wanted to start just with a very brief sort of overview of some of the latest understanding of the science of climate risk. We'll do a reminder again of the definition, insofar as that there is an agreed definition or some agreed definitions of loss and damage. I wanted to talk a bit about some of the solutions that have been proposed in different venues for how you could start to address the problem, and then talk a little bit about how health fits into that puzzle. So obviously, I mean, you could spend many hours, if not days, if not weeks, talking about the science and the risk. This is my attempt to try and pull out some of the key takeaways from the IPCC Working Group 2 report, which looked at climate impacts, adaptation, and vulnerability. And again, some of these points raised by Maria, but essentially, I think, for one thing, we're closer to the worst case scenarios than the best case scenarios on this. I think impacts are hitting earlier and harder than expected in many cases. Losses and damage, it's here. It is happening today. There's a new focus in the latest report on the impacts on the social impacts, on ecosystem impacts. There are clear links with water and food production, but also health, as Maria pointed out, and then infrastructure damage, of course. The risk is complex and systemic. So it's not just the hurricane hits and it's the immediate aftermath of that. This is a risk that cascades across societies in really complex ways. It's a driver of displacement. It drives humanitarian crises. In some cases, it's as they say, a threat multiplier. Possibly contributes to conflict. And adaptation is clearly an important piece of the response, but adaptation is falling short. So efforts are fragmented. They're usually pretty project focused and incremental. They're often sector specific and very much focused on planning rather than implementation. And even then, there are hard and soft limits to adaptation, which is something else the IPCC talks about. So, there are hard limits in the sense that there may just be some physical risks that you can't adapt to because you can't build a big enough seawall, for example. There are also soft limits to adaptation where, money isn't available, or maybe it is available, but it's not the communities that are vulnerable can't access it. There may be regulatory or governance hurdles that need to be crossed. But the point being, some loss and damage will be unavoidable, and that's really concentrated in the poorest and most vulnerable communities. And then finally, this isn't just an engineering problem. There are lots of technical solutions available, but how societies respond to this really matters. So we need to think about reforms to governance systems, including making sure that governance is inclusive, rights-based approaches, issues of equity and justice when thinking about climate risk management, which again are a couple of things that Maria touched on. I won't go into a huge amount of detail describing this graph, but I find it sort of a useful illustration of the fact that essentially the risk is actually quite high at quite low temperatures. So if you look at the bar graph on the right side, essentially the white area of the bars is where there's no observable risk. Yellow is moderate, red is high, and purple is very high. And as you go up the bar, you're getting into higher temperature thresholds. So you can see essentially the first bar, RFC1, which is unique in threatened systems. So that's things like coral reefs, for example, or great glaciers. Even at 1 degree, which is where we are now, the risk is already high. And certainly as you pass 1.5 degrees, which we are getting pretty close to, it's very high. And it's a similar sort of story for extreme weather events, which is the second bar from the left. At 1 degree, you're starting to get into the high risk. And certainly as you approach 2, you're at a very high risk. So it's just to sort of put in context the level of risk and where that falls in terms of temperature thresholds. As far as the definition, so as Maria correctly pointed out, there's no universally agreed definition or legal definition of loss and damage. The IPCC talks about it as broadly to harm from observed impacts and projected risks that can be economic or non-economic. I think it is often understood as harm related to climate impacts that can't be avoided through mitigation or adaptation measures. So it's essentially, you hear about averting, minimizing, and addressing loss and damage, which is the language used in the UNFCCC. Averting being, you avoid it entirely through emission reductions, essentially. Minimizing being, you implement certain adaptation measures to minimize the harm. And then the sort of addressing loss and damage is all the residual risk that's left over. So what you can't deal with through mitigation or adaptation. And I think another important point to mention is just that it can arise from either these sudden events like hurricanes or slow onset events like prolonged drought or sea level rise. Again, I think a critical point, particularly for the health conversation, it can be economic or non-economic. So economic, fairly straightforward in many ways. We've all seen some of the infrastructure devastation following extreme weather events, for example, climate impacts pushing, many countries into debt distress, sort of costing, beyond 100% of their GDP. And this is only going to get worse. So the UN is estimating that by 2030, developing countries could be facing up to 580 billion in economic cost of loss and damage. And that's right around the corner, obviously. But then there's also this non-economic component. So that's things like mortality, mobility, mental well-being loss, but also loss of biodiversity or species, culture, traditions, heritage, human dignity. Displacement could fall into this category. And I think, again, as I think Alison maybe already mentioned, non-economic loss does not mean that there is no economic cost associated with. Obviously, there are economic costs associated with things like displacement or loss of livelihoods. It just means it can't be, fully accounted for from an economic standpoint. As far as some of the policies or other solutions that are being discussed, so obviously there's a conversation around new sources of finance. How do you mobilize funding and money and make sure that that's getting to affected communities quickly, whether that's through potentially new funds or facilities or mechanisms or existing funds. There's also discussions about, innovative approaches to raising finance, for example, through things like a fossil fuel tax or levy. There's a discussion underway about how you bolster social protection systems, including things like cash transfers to households. There's a discussion underway about technical support that may be needed and will probably come to the Santiago Expert Network and the UNFCCC a bit later. There's obviously a role for disaster risk, finance, and insurance, although I think the needs are not being met by the existing resources at the moment. And insurance certainly, while it's clearly plays a role as a solution, it's obviously not the end-all be-all answer to loss and damage. And similarly on humanitarian support, increasing humanitarian support is clearly one of the things that needs to happen. But again, there's a big gap between sort of needs and resources available there. And loss and damage also goes beyond what humanitarian support typically provides. Then there are things like better early warning systems, better data collection, and there's a sort of emerging conversation around things like, legal protection, for example, for climate refugees. So this is not meant to be an exhaustive list. Obviously, there are other solutions that have been proposed, but this is sort of a taste of some of the things that have been discussed in terms of solutions to addressing loss and damage. And then finally, just from my perspective, why health has to be a really integral component to any loss and damage conversation. As we've already discussed, climate risk and loss and damage is a systemic problem. Climate impacts are threatening fundamental systems upon which human prosperity relies on. Food, water, security, and certainly health falls into that category. That really demands an integrated whole of society approach. This is not something that any one agency or department or actor can address on their own. It needs to be comprehensive. And then of course there are these positive and negative feedback loops. So a safer climate is going to lead to better health outcomes, which contributes to more resilient economies and sustainable development, and vice versa. So again, that's meant to be a fairly brief, high-level overview of loss and damage as an issue, obviously not going into all of the details, of which there are many, of how it's understood in the context of the negotiations, for example, but hopefully some helpful background. And I'll stop there. Thanks.
Just as I wrote 1 minute, you wrapped up. That was fantastic. And I think that puts a lot of what Maria put into that bigger climate conversation. Again, health is one component, but it's quite a substantial component, I think, of that overall impact. And it's certainly the most stark human component of the impacts of climate change. But it's great to see it in that whole range of direct impacts and risks and threats that go beyond particularly those that just go beyond the financial. We'll move on now to Colin and to bring it into that UNFCCC space and the processes that happen there. So we'll move on now. Colin.
Thanks, Alison. Can I just check that everybody can see my screen? Can you see my screen?
Yes, we can.
Great. Perfect. So yes, hello everybody, I'm Colin McQuiston. I'm the head of climate and resilience at Practical Action. Practical Action is a development NGO. We've been working around the world And the reason that we're working in the loss and damage space is the realization that many of our projects and programs around the world are facing irreversible impacts of climate change, which are eroding those development gains that we've been delivering for the last 50 years. And I think the interesting thing about loss and damage is a relatively new aspect of the climate negotiations, but it is something that has been around since the climate emergency was first uncovered. So the Association of Small Island Developing States, they quickly realized that climate change, warming of the atmosphere, melting of glaciers, increasing sea levels was an existential threat to their future survival. So they were talking about loss and damage before the rest of the world was in the early 1990s. I think over the last 2 years, we've seen a real upturn in debates around loss and damage. And I think it's really because the world's waking up to the fact that we're seeing loss and damage taking place around the world. It's no longer limited to developing countries. It's no longer limited to remote frontline communities. You know, we're seeing it in the wildfires in Australia, the heat stress in Europe, as well as the massive floods that we saw in Pakistan. But I think the interesting thing about the floods in Pakistan is they followed massive heat stress in May of this year in Pakistan, which again are clearly attributable to climate change. So you've got a country that has a heat emergency leading to massive health problems, and then a couple of months later, massive flood events. And I think the other thing that Maria highlighted, it wasn't a flood event, it was multiple flood events. So it's changing from large-scale flood events, which have happened since time immemorial, to lots of flood events all happening at the same time. And this is where systems are being stressed. And why are we here? Well, we're here because we didn't do enough early on. We've been ignoring the science about climate change for far too long. And this diagram is just trying to describe the cascade of consequences because we are failing to listen to science. Mitigation, avert the climate emergency. Well, we haven't done enough mitigation. You know, coal power is still one of the biggest sources of power in North America. That could have been eradicated a decade ago. That is the mitigation gap. Now that is leading down to this need for adaptation. The climate emergency means we need to adapt to climate change, but we know globally that the efforts to adapt to climate change are far out of kilter with what is needed on the ground. And that's the adaptation gap, which has led into the emergence of this issue in the UNFCCC about loss and damage. Loss and damage is about addressing the consequences of failure to mitigate the climate change, which is leading to irreversible impacts that we can no longer respond to. When a small island disappears under the sea, we can't drain the ocean and bring it back above the sea level. That's an irreversible impact. But we also know globally, there's a lot of things we could have avoided if we'd invested in adaptation earlier that we failed to adapt to. And then when a climate emergency happens, loss and damage occurs. So we have this loss and damage issue, and it's about addressing loss and damage that the UNFCCC debate is primarily focused on. So this is what loss and damage looks like in the physical world. And this is a diagram that's been produced by the UNFCCC Secretariat. And it just describes the different types of manifestations of loss and damage across human systems, across ecological systems, and across social systems. And I think the most important thing to bear in mind is something that's already been raised, is that we have economic impacts and we have non-economic impacts. They may have an economic consequence, but they're difficult to value or come up with a universal value for. And then we have rapid onset events, the floods, which take place. But we also have these slow onset events where we're seeing climate change gradually leading to changes in systems. And it's both which are the primary focus of loss and damage. So I just had a quick look at the literature around climate change impacts on health. And of course, there are the direct impacts. There's the things like losses of lives, there's injuries, there's of course a lot of stress in communities that suffer these events and suffer these events more frequently, and they're less predictable. We've also got biodiversity loss as a result of acidification of the ocean, as a result of sea level rise, as a result of glacial melt. These things all happen. But I think where really is important is thinking about the cascade of those direct to the indirect outbreaks. Maria's already talked about disease outbreaks post-flood. We get degradation of support services. One of the things that I picked up when I looked at the web on health impacts of climate change, it was all about air pollution. But we also have problems with water, as Maria highlighted. We've also got loss of soil quality as a result of heating, as a result of degradation of soil carbon. So we're losing food security, we have impact on food security. We're losing houses, we're losing critical infrastructure, we've got disruption of supply chains. Medicines can't get through, people can't get the help that they need. So we have the direct impacts, and then of course we have the indirect consequences. So loss and damage has only really been an issue in the climate change debate since 2013. And it was at Warsaw at COP19 that finally the Warsaw International Mechanism for Loss and Damage was first established. And this created a space within the United Presidency negotiations to think about loss and damage. Now, it was established in 2013. It has been in existence now almost a decade. It's really struggled to deliver very much. I think the most significant moments were at COP21 in 2015, when loss and damage was included in the Paris Agreement. But as Taylor has already highlighted, what we started out was a Warsaw International Mechanism to address loss and damage, but then the Paris Agreement brought in these two other words, avert and minimize. So now we talk about avert, minimize, and address loss and damage. But the piece of the puzzle that's not currently covered under the UNFCCC language is the address. Avert, mitigation. Minimize, adaptation. Address loss and damage. That's the missing piece of the puzzle, and that's where the negotiations need to focus in the future. So some of the critical issues in regards to the climate change negotiations are the fact that it's taken too long for loss and damage to be recognised. It was first raised in 91. It didn't enter the UNFCCC lexicon until 2013. We haven't really seen any progress on it. We don't have an operational mechanism. We don't have a fund for loss and damage. And we're 10 years after the Warsaw International Mechanism was established. So it's very slow progress of the Warsaw International Mechanism itself. I think one of the other limitations on the Warsaw International Mechanism is it's dominated by expert groups, which bring together experts in particular areas, but it doesn't bring together experts who work in areas that are currently not invested in or resourced. And I think health is an interesting area that the Warsaw International Mechanism maybe needs to start thinking about when it develops its work plan. The crunch moments, I think, was at COP25. I work a lot with the UK government. At COP25, it was really difficult to talk about loss and damage. By COP26, when we looked at the presidency's propositional paper for the negotiations, loss and damage was mentioned 11 times. So they went from not talking about it to talking about it. We need to continue that momentum. I think at COP26, the G77 and China in the first couple of days of negotiations, made their position clear that they wanted a loss and damage finance facility. They actually called it the Glasgow Loss and Damage Finance Facility. So it really has ramped up the agenda. And that's why that first slide I showed about the newspaper coverage, that's why loss and damage is now gaining traction in global media. There's the governance of the WIM. That's an issue that has been a long-standing issue around how it should be governed long-term. But the two critical issues are the Santiago Network for Loss and Damage, which Taylor has already mentioned. It's a technical body to try and provide countries with the technical assistance that they need to respond to loss and damage. Hopefully, at COP27, we will make significant progress on what that network needs to look like. And the most important thing, it needs to learn from the GCF. It mustn't be high-level accredited agencies. It needs to be frontline responders. It needs to be those agencies that are working in the communities where loss and damage impacts are occurring. We need to provide support at that level and not at the global level. And then the second thing, of course, is without resourcing, that technical body will only be able to provide technical advice. It'll be like having your house destroyed and it paying for the architect, but sadly there are no resources to rebuild your house. And then finally, issues around human rights, around migration, around debt and litigation are all on the horizon if we don't start to act on loss and damage. And then finally, another point was in a paper of climate change impacts in health. This is a summary paper of global reporting. And I think one of the interesting things is, of course, who is reporting on climate change impacts in the health sector? It is predominantly the global north. We really have an absence of researchers working in the global south actually documenting the health impacts of the climate emergency and what loss and damage means for people who are suffering from climate change. Thank you. I will stop there.
Thank you, Colin. That's great. Real contrast between the urgency and the emergency that we've seen throughout the different presentations and the slowness of the processes within the UNFCCC. But it is good to know that it's building momentum at last. Too late, but it's moving. And I know maybe we'll come to the questions that there are those who are pushing and insisting that it moves forward, and those that are holding back those discussions, usually about resourcing. So maybe we can come to that in the questions. But definitely, last but definitely not least, we've got Liz Willits from WHO. I'll hand over to you, and let's look at what the health community responses can be.
Thanks, Alison. Just to check, can you see my screen? Great. Thank you so much for having me here. It's been really interesting to hear the other folks on this panel. And the WHO Climate and Health team is really interested in this space. And we have done a good bit of research and just wanted to put out there that we will be producing a brief for COP27 on a number of the science and policy aspects, as well as the recommendations or how COP27 can promote public and global health. So Alison asked me to talk today about how the health community can respond to and prepare for disasters and how negotiations under the WIM can promote health. I wanted to first draw attention to where the WHO is coming from on loss and damage, and just highlight the three elements of the program of work, the triple billion targets. Those targets are aimed at having 1 billion more people benefit from three elements: universal health coverage, protection from emergencies, and enjoying better health and well-being. And one reason I wanted to bring attention to this is that loss and damage hits all three of these targets. And then when we go and look a little more closely at the Sustainable Development Goals that are under WHO custodianship and that are health related, I've listed these here: stunting, malnutrition for under 5, anemia in women, malaria, neglected tropical disease, non-communicable diseases, drinking water, sanitation. If you look at the IPCC AR6, there are projections that essentially indicate all of these are being negatively impacted and will be increasingly negative impacted while the WHO is trying to achieve them. So in terms of our mandate, we have the triple billion targets and we have these health-related SDGs, which we have a focus on. I'm sorry. We have a graphic that we put together here to try to understand a bit better what the scope is for entering the UNFCCC conversation from the health lens. We tried to put it out visually, and the pieces of the puzzle that come into focus are: we have the Warsaw International Mechanism, and from a health view, it has two main components where we see entry points: the Santiago network, which has been mentioned quite a bit, and that network intends to provide technical assistance to developing countries. The second element that is of interest and will continue to be further developed is the expert group on non-economic losses. This group has had an agenda that includes various health elements, including a potential nexus study on health and biodiversity. And it continues to take this work forward. At the moment, the agenda is looking at support strategies, technical guidance, recommendations on this element of non-economic losses under which health fits. And over to the right, we just tried to portray the scope of health non-economic losses that we're dealing with. And I just pointed out also that there is the Sendai framework for disaster risk reduction that also plays in this space and also involves health sector. And it's good to keep in scope exactly the players for this work. And one of the reasons for that, I'll come to later, relates to the actual function and arrangements of the Santiago network and what it's trying to do and who's trying to do it. So one thing that has come to mind for me in thinking about loss and damage is big picture. This is essentially the largest payment for ecosystem services plan that we've ever tried to do. It's a global payments for ecosystem service, paying for damages. And that is an enormous challenge in itself. When we look at the actual problem of valuation, there are a few elements I wanted to highlight. First, do we have the tools? And one problem is that we are essentially designing the environmental economic tools that are incorporating health metrics at the same time that we are in negotiation to make decisions on how to value loss and damage, specifically non-economic loss and damage. So we are pacing the development of the work with leaders in the field at the same time we're trying to make decisions. That's very challenging. Those sorts of health metrics include a focus on developing health outcomes rather than, for example, health outputs. So health outcomes are new to the literature that's doing environmental assessment. Health outcomes such as disease, mortality, morbidity, rather than health outputs such as revenues to hospitals and other economic costs that aren't focused on actual health conditions. And the second issue with valuation, which is strongly highlighted in the Intergovernmental Science Policy Panel on Biodiversity and Ecosystem Services, who just put out a valuation study, is whether we have the methodology to interpret diverse values of non-economic loss. Much of non-economic loss is related to both the social and environmental determinants of health. Much of that is values-based or must be interpreted by culture. And in order to have consistent methodology to include these sorts of values alongside economic values, it's very challenging, and we, again, are in an early stage of doing that. I just wanted to highlight from the World Bank that the value of non-economic losses is actually potentially higher than the value of the economic losses. And there are some studies that they have done on this. Then the third part about valuation is looking more closely at vulnerability. In order to address loss and damage, we really need to have stronger mapping of vulnerability. And so assessments need to move beyond climate exposure risks and look at an additional layer of vulnerability to subpopulations. I said this point earlier, but non-economic losses can be more costly, more difficult to recover from at the level of individuals, health sector, and the economy. There's also a very strong impact on children and their future development and ability to thrive. And then when we start looking at climate resilient development and how the focus on this element should be taken forward, have to remember that loss and damage really is putting a different starting point for the most vulnerable countries and communities. So to get back to the health aspects, something that we are continuing to look more closely at is what is non-economic loss for health. And we will have more details on this in the brief that we're putting forward. But on this slide, there is a column that lists basic, direct, and indirect impacts. So the top four here are direct impacts, and the bottom box is indirect impacts. We hear a lot about the sudden events and the sudden emergent health conditions that come from them. We think we also need to focus on the slow onset conditions that come from both direct and indirect impacts to non-economic loss. To that point, the IPCC AR6 points out that we need more understanding on slow onset events. We also want to draw attention to the importance of slow onset conditions. So that means not only the conditions that arise after the emergency has subsided. So for example, the food security issues that are emergent and were discussed with MSF then can lead to very severe chronic malnutrition issues and susceptibility to various health conditions as that child, adult, family develops. In the first 2 years of life, the quality of nutrition can have a very large impact on stunting, wasting, development of brain and behavior, as well as on susceptibility to non-communicable disease and diabetes and things like this. These are currently not accounted for and wrap up in the picture of costs and preparation that need to happen specifically in the health sector. And then, of course, they have to understand better the physical and mental components of the health impacts. And this is currently a pretty big gap in the literature. Looking more directly at COP27, Colin did a really nice display of the negotiations to date. And he mentioned that COP27 is really going to be about the arrangements of the Santiago network and what that will practically look like with what he recommends a focus on funding for frontline agencies and actors. And so in our view, this space needs to be very well coordinated. There are quite a number of groups that are working in this space, and at this time, I think there are two gaps. One is coordination amongst each other on loss and damage, and second, better awareness of what's being decided in the UNFCCC under the Santiago network that could affect them. Overall, the Santiago network should be focused on being shock responsive, and that includes the immediate shocks as well as ongoing shocks that will require a great deal of investment in community level work. The idea that mitigation, adaptation, and loss and damage are now almost a tripartite, it seems to be a framing that makes sense to us, since these long-term impacts and a wider scope of non-economic losses really haven't been addressed. And so separating these three pillars seems like a good way to draw attention to this issue and start to build up investment in the loss and damage space. Looking at COP27, we are trying to develop our messages on what would best promote public health. And in our view, I think development and funding of the Santiago network will promote better health response and coordination, preparation, needs assessments. In addition, as Colin was saying, the Santiago network can provide advice unless it's funded to do otherwise. And so implementation of coordinated activity as well as will be important. And then the one of the functions of the network in the near term is to develop a needs and gap report on loss and damage specifically. So, and this is going beyond adaptation plans or health national adaptation plans. It's developing a needs and gap report specifically for things that cannot be addressed through adaptation. And this is important. There are various ways this could be approached. From our end, we work with ministries of health to develop health national adaptation plans. About 60 to 80 countries who are in various stages of developing those. And these perhaps could be expanded to include a component on loss and damage. So to separate the pillars and to develop some understanding on the ground that there are some things that will fall outside of adaptation and will need funding for that. And then in terms of doing the assessments, really boosting the look at vulnerability and making sure economic and non-economic losses are looked at together. In the big picture, the health sector is going to need significant preparation and investment for how to handle these challenges, both the emergencies as well as increased incidence and prevalence of diseases such as respiratory conditions, diet-related issues, cardiovascular disease, traumas, and mental health impacts to not only individuals, but entire communities. And the resilience of the health sector needs significant focus. And again, just a last point on the importance of not only looking at emergent health conditions, but also the slow onset conditions. I'll leave it there. Thank you.
Fantastic. And again, a real contrast between, you've got a real urgency of impact of, you know, there's a rapid onset, there's those that are progressing that really create start situations, and then the complexity of that response mechanism, the details, the funding, the technical assistance, getting that right. And it's really quite complex to get it right. And I think there's definitely a need to get more health and medical and disaster response, like MSF, voices into that space to help shape that response in such a in an effective way. So thanks Liz for sort of contrasting the urgency with that need to get that complexity right and get health voices in there. So I see there's a couple of questions. We've got about 10 minutes left for questions going on. So I'm going to just jump in there. And I do know that the first one I believe was responding to Maria's work, but maybe Colin or others might want to come in. As you mentioned, you're working with the community. My question is, what can the community do in terms of localized action to overcome the health related loss and damage for vulnerable communities? So what can that local action be? Maria and Colin as well, as if you want to come in.
Sure. Thank you for the question. And it is one of the things that we're doing anyways with regards to the way we do our emergency response, and is that focusing again with communities as partners. So let me try to put that into 3 pillars that I mentioned earlier. So first is the operational adaptation and how we actually empower the community. One is obviously in the health and in understanding what they can do to protect themselves and understand what the health issues are, and so they can seek health care sooner than later. The second is also giving them the tools, because as we know, even as responders, we're always trying to catch up within the 48, 72 hours. It's the community that needs to be able to anticipate and plan where to go and how to do this. So when a disaster happens, and empowering them with more tools to anticipate is something that could be useful. And how do we do that together and design this so they own this as much as well? We're also helping them, for example, in the, that sometimes adaptation is mitigation in itself. So in responding to, let's say, different outbreaks like cholera, and this was already dating back in 2015, is how do they, is always the access to clean water is a problem. So what we've built was created this community clubs. We dug boreholes and rehabilitated boreholes, like in many of the neighborhoods within Harare, for example, in Zimbabwe, which is the capital, and created community clubs that preserved those boreholes. So they owned this and kind of supported each other and created a team to protect that. And that was in 2015. But if we were to move into the mitigation pillar, we also in one of the neighborhoods of Harare in 2019, we worked with them on the waste transfer systems, because of the stagnated waste was also creating problems in cholera outbreaks or other acute diarrhea incidents. And with creating this kind of where they kind of preserved that station, they understood what it meant to keep to manage waste correctly. And finally, with trying to give them tools, it's also empowering. It empowers them to have more voice. And I think in this platform, and as we move forward, whether that's through the Santiago network as it gets developed, and the COP27 and these platforms, we need to embolden them to have the voice to come to bring to the table. Because what's missing is a humanization and the ground reality in the dialogue. And I think we need to ensure that the communities are there.
That's great. That's a great point to end on there, just that bringing that stark reality into that conference negotiation space. Colin, did you want to come in on that one? I know you work locally a lot.
I think what would be key is we've got some really good initiatives. It's just getting those initiatives delivered at scale. You know, if you look at a Red Cross, Red Crescent program in a country, they often do first aid training. And first aid training is a really good way to respond post event. But do they have, is it delivered at the scale necessary? And particularly, we tend to be quite good at training people, but then not following up on that training. And I think one of the critical things, and I was in Nepal just a couple of weeks ago, and it was during the monsoon. So communities were talking about their experiences, and they'd just done the mock drills before the monsoon season starts. So they practiced. They'd got the groups together. They'd made sure that the equipment was working. They made sure that their front loading of supplies were where they thought they were, so that when a flood event or whatever the climate impact is, they know that they've got those materials to hand. And I would agree with that point that Maria made. I mean, you know, we can raise water pumps, we can raise toilets above the flood levels, but we're not doing it. And I think that's probably what we need more of. So thank you.
Thank you. Move on to the next question is, what do the panelists see as the key research needs, questions, gaps for loss and damage as it relates to health? It's an interesting one. Where's the information gaps that we need to be filling? I wonder who wants to come in on that question. Or where should loss and damage people research more on the health? Liz, do you want to come in?
Thanks. I'll just come back to one of the points I was making in our slide presentation on valuation and the importance of really including health metrics in environmental assessments and environmental economics. I know some countries are bringing that forward and noticing that gap, but it should not be neglected. And then in addition to that, looking at the value of disaggregated data, so not just in terms of gender, but also in terms of age. So really looking at children and youth and how this is going to impact these different age groups going forward. So not just in this emergency phase, which is very critical, and there's a tremendous amount of work being done, but also long-term and where we go from there.
You're muted, Alice.
Yeah, sorry. Anyone else want to come in this?
Maybe I can just compliment. I can only support what Liz has said. I mean, I think there's a need to quantify this from the health and then actually into the emergency, and how do we connect the lived experience to the actual research and bring them together. And I think there's a lot of work that we need to do with MSF and actors like us to connect with those who are more adept in actually putting research together. Yeah, it's this partnership that probably needs to happen.
I think that's a fantastic point. It is a coming together of the different sectors to really make it happen. And then bring it back to that negotiating space. The third question we've got here. Is there is there an existing loss and damage counterpart to the nationally determined contributions, the NDCs, basically an accountability mechanism? And if there's not, which I suspect there's not, what would you recommend in drafting one? How do you represent health and the social environmental issues that come along with that, those non-economic losses and damage? So I see Colin nodding away there. Maybe you want to come in this.
That's a great question. I mean, ultimately, the nationally determined contribution is a whole of society approach to climate impacts. If climate impacts are causing, if loss and damage is a significant impact in the country, it should be in the nationally determined contribution. I mean, basically, we have to get that message across that what goes in the nationally determined contribution is what represents your national climate strategy. And for those countries that are suffering huge costs as a result of loss and damage, they need to put it in the nationally determined contribution. I think where the challenge lies is how do we develop the metrics? I think Liz highlighted, one of the issues is we don't really think about health when we start calculating losses and damages as a result of a climate disaster. I think we need to do that more. And I think one of the things that I would really like to stress is I have been surprised at just how significant a trigger, particularly stress, has been on people's reactions to climate events. And it was highlighted in a couple of the presentations that we're overlooking one of the key drivers of displacement and migration. And that's seen as a problem, but we're not thinking about the psychological health issues, which are the trigger. And it's people worrying about future disasters, not knowing about future disasters. So I think having effective loss and damage needs assessments at national level is needed. They need to include health parameters and indicators in them, and countries need to be feeding that into the NDC. We also need to make sure that loss and damage is included in the global stocktake, and we also need to be thinking about the new collective quantified goal, the post-2025 climate finance target. We're going beyond 100 billion. That needs to include a loss and damage portion as well. Thank you.
Yeah, Liz.
Very quickly, I also just wanted to highlight how confusing this space is. And there's a great need to really raise awareness of what exactly loss and damage is and how it's differentiated from the other pillars. And in that sense, that can help drive the conversation that Colin was highlighting further.
That's a fantastic point, I think, which the presentations here have shown really that end, which is loss and damage, where you cannot recover. I'll just do a flag for the Global Climate and Health Alliance NDC scorecards that measure how much health is part of the NDCs. And I think a flag there to get loss and damage and health related in those NDC spaces is something we can maybe be effective in lobbying in. We have come to the end. There is one more question. I don't know if Liz wants to touch base with that question, because it's for WHO specifically about minimum recommendations for disaster humanitarian situations. But I'm afraid we have run out of time. I've certainly learned an absolute load from this. I think hopefully that will raise confidence, as I said, both for climate people to bring health into that argument, but for health people to step into that loss and damage space. I'm going to make this the presentations, which I thought were outstanding, and an outstanding package together. I'll make it available as a recording for others to come and use as a resource. But I'll just take this moment to thank all our panelists. I think it's been a great event, and thank you everyone for being part of it. And I hope this has started something for all of us that we can take forward into COP27. Thanks very much. And very much big thank you. This has been an HCN and E3G joint event, and a big thanks to E3G for really supporting and pushing this initiative as well. Thank you.
Thank you.
Thank you. Bye-bye.
Thanks, everyone.
Thanks, Alison. Bye-bye.
Thank you all. Thanks, Alison.